All right, so there's this really unnerving situation developing,
Yeah.
and we need to unpack it.
Yeah. Definitely concerning.
It's in the Democratic Republic of Congo, and it sounds like something straight out of a thriller.
Oh,
Like
yeah.
a remote village, the Pansy Health Zone, they call it, and people are getting sick.
Mm-hmm.
Sounds pretty normal, right? Like
Yeah.
fevers, headaches. It's like, oh, flu season, maybe.
Right.
But
Exactly.
then a month later, 143 people are dead.
Wow. That's
not
not
your average flu, that's for sure.
So we got to figure out what's actually going on here. What makes this outbreak so different and so scary?
Right, yeah, and I think the first thing that really jumps out is just how fast this thing is moving.
Yeah.
143 deaths in just November alone. That's a lot, especially for somewhere like Pansy.
Yeah.
It's in South Kivu, if you look it up on a map. And that whole province has had a lot of issues, conflicts, instability.
Right.
And then on top of that, you throw a health crisis. It's not good.
It's a recipe for disaster, really.
Yeah, it's a brutal situation, reading these reports. They're calling it extremely worrying, and it just seems like every day more and more people are getting sick.
Yeah.
And they're trying their best, obviously,
Yeah.
but they're lacking even basic medical supplies.
Yeah. One of the local leaders was talking about how they just don't have access to medicine,
Right.
like the most basic stuff. And that's what's really scary, because then it's like a domino effect.
Absolutely.
No medicine, people are just suffering at home.
Right.
They can't get treatment, and a lot of them are dying because of that.
It's heartbreaking. And what's even more troubling is that this disease seems to be hitting women and children the hardest.
Yeah.
It's like, why are they so vulnerable?
That's the million-dollar question, isn't it?
It really is.
It's got to be a bunch of different things, I would think,
Yeah.
Maybe nutrition, maybe they already had some health problems, maybe it's just their roles in the community, Think about it, in a lot of places, women, they're the caretakers. They're looking after everyone, so maybe they're just exposed to it more.
Right. Yeah.
Or maybe it's about access to health care. I mean, are women and kids getting the same level of care as everyone else? Are they even going to the doctor in the first place,
These are all really important questions.
Yeah, definitely. And finding out the answers is going to be crucial to actually fixing this.
Yeah.
You got to understand why they're so vulnerable so we can actually help them.
Absolutely. So at this point, it's a race against time, right? We need to figure out what this disease is, and we need to stop it from spreading.
Yeah.
The good news is the World Health Organization, the WHO, they're aware of it, and they're already there working with the DRC's Ministry of Health.
Okay, good.
They've sent in a medical team to investigate.
That's good. That's good. That's what we need.
Yeah. So they're collecting samples, trying to pinpoint what this pathogen is.
Right, because once we know what it is, then we can figure out how to contain it.
Exactly.
And how to treat it.
Yeah. And until then, it's a waiting game.
Yeah, every day counts at this point.
It really does. And, even though Pansy is pretty remote, what happens there, it can impact everyone.
Yeah, that's what people don't always realize.
It's a global issue.
It really is. It's like, think about it.
Yeah.
You have this potentially deadly disease. It's spreading in an area that doesn't have a lot of resources. It doesn't have good health care. And that's scary.
Yeah.
It shows just how interconnected everything is,
Right.
What starts in one corner of the world can very easily spread to another.
Yeah, this really highlights the need for more international cooperation and for better healthcare systems, especially in these more vulnerable regions.
Absolutely. We need to be able to detect these things early and respond quickly.
Right.
That's how we prevent them from becoming like global pandemics.
Exactly. And it makes you think, like, are we doing enough? Are we prepared for something like this happening again?
That's the big question, isn't it?
It is.
Because it will happen again. It's not a matter of if, it's a matter of when, and are we ready for it?
That's something to think about.
Yeah, definitely.
I think that's a good place to leave it for today.
Yeah, I think so too. Lots to think about.
As always, thanks for joining us on this deep dive.
It's been a pleasure.
Stay tuned for more updates on this developing story.
And stay safe out there.
We'll be back soon with another deep dive.
Until then.
Take care.
Bye.
Bye.